New year, new you with new technology for your skin. Dr. Sherry Ingraham with Advanced Dermatology is here with a look at some of today's most popular procedures. Good morning to you.
Good morning.
You also brought in a beautiful patient.
Miss Annie.
We'll be talking to her in just a minute, so thank you for being here as well. So let's talk about new technology first of all. I'm intrigued by this. What is it?
So it's really exciting. La Roche-Posay, which is a L'Oreal-owned French-based company, came up with this amazing device called the My Skin Track UV. It's this small little device that is about 6 millimeters by 12 millimeters, and what it does is it reads the ultraviolet exposure you get in a day, which is essentially your max sun stock. So every
it's just a little bitty clip. I didn't even notice that you had it on.
Yeah, you can put it on your purse, you can put it on a necklace. What you want to do is sync it every morning with your phone. So it works with Android phones, iPhone 7 and higher. So you sync it by just touching it. It uses NFC, which is near field communication, which is really cool. And it tells you the environmental aggressors you're exposed to. So it'll give you kind of what Tom tells you. It'll tell you the temperature, the humidity, and as well as a pollen count, and really the UV index and pollution for the day, because we know pollution combines with ultraviolet light to make sunspots and more skin damage.
So what will that do? Make us, perhaps prompt us at least to wear more sunscreen, or what's the hope there?
It gives you little hints throughout the day. So it'll send you messages, and it'll make product recommendations. So La Roche also makes amazing products that are for your skin. Sunscreen, it'll make recommendations, because you'll enter your own data. You'll enter your skin tone, skin type, some of your skin concerns. It'll computate that with your UV exposure and give you suggestions.
How intriguing. Okay, let's talk about some other problems that a lot of people have. What about acne? Anything new to treat that these days?
Yes, so for acne, the big discussion is, of course, scarring and what we can do to prevent scarring. So there's a lot of procedures that we do. Of course, we've done chemical peels. IPL, there's more and more research showing intense pulse light actually can treat acne. So we're using that more, not only for acne, but acne scarring. So you want to go to a board-certified dermatologist, look for photofacial IPL, as well as skin pin microneedling for acne scarring.
Okay, and then what about just fine lines, wrinkles?
Right.
Fillers are really popular.
We're really excited. Volbella, which is part of the Juvederm collection, which means it has the Vicross technology, is one of the most recently FDA-approved fillers, not only for the lips, but it's such a fine particle size that you can inject it into the perioral lines. So for what we call smoker's lines, which most women do not smoke who have them, they're, you know, they're more kind of, I say, conversation lines.
Sure.
But you can use this product and it will look natural and smooth, and that's the neat thing.
And I've even read that drinking out of a straw or from a water bottle, because you're pursing your lips, is the same movement as smoking, and so you might want to consider drinking out of a cup.
It's true, but you know what? I love a good straw. They're not good for the environment, though. That's the main thing. But the beauty is we can put a little Botox in these lines, but we can also do a little filler. And you can look at Annie. She's got gorgeous, naturally plump lips, but as she ages, we lose a little volume. So what we're going to do, and she's nice and numb here, is along what I call the vermilion border here, we're just going to put a very small amount to give her a little lift. And the nice thing about Volbella is it's made of hyaluronic acid, which is a naturally occurring sugar in our bodies that's regenerated into these products and gives a smooth, smooth appearance.
And so how quickly is she going to see these results? Almost immediately?
Yeah, instant gratification. And she can go back to work. She can go out to lunch with her friends. She may have some swelling and bruising, but these are temporary. And the nice thing now is with the newer technologies, these products will last about a year in most individuals.
Wow, that's a big deal, isn't it?
Yes.
While you continue to work on her, I'm going to ask you just a few more questions about just overall. Well, what about for losing weight, especially around the face? Because you know, a lot of people are working on those selfies and they're concerned about that double chin. Do you have suggestions for that?
It's all about going to the office, looking your best in the selfie. And so some of the best things now are Cool Sculpting and Kybella. And Cool Sculpting now has a wonderful neck applicator. So patients can come in, they can watch TV, sit for 30 minutes, and we can actually trim their neck. It's a very, very quick, no downtime.
Trim as in you freeze the fat.
You freeze the fat away,
You're going to make it a little chilly.
No downtime. And then with Kybella, which is an injectable, they can come in and we can inject the area. And after a few treatments, that felt will also melt away. And they're non-invasive procedures, essentially.
Well, new year, new you. You've got all kinds of ideas for us. Annie, thanks for coming in. Your lips look lovely. We got to work on the other side now.
Yep, balance her out.
Dr. Ingraham, thanks for being here.